Hey, family, my name is Chris the sonographer. Yes, today is another episode. Yes, coming your way from last week. It is going to be an interesting, very educative and informative. So stay tuned to the end of this video. If today happens to be your first time watching me, don't forget to follow me. My name is Chris the sonographer. I am your health educator and a professional sonographer. I've been doing this for the past 3 years, and then it is yielding a lot of impact. And today's version is a video, an old videos that I've done, and I'm rebranding it or reloading it, So the topic is importance of ultrasound in pregnancy. Importance of ultrasound in pregnancy. Good. Yes, I believe you enjoyed last week's one. Today's video is also coming up. Stay tuned. Watch, share my videos, comments, like. Don't forget to also follow me. You can also follow me on all my social media handles right here on TikTok. Click the plus sign on right here on Facebook. Then, just follow me, share the video, and then comments, like. Right here on YouTube, do the same. I want you to subscribe to my YouTube channel so that anytime I post the video, you get the notification. You can also get my YouTube channel link on my TikTok profile, and then follow me on Instagram as well. You can also connect me on LinkedIn. Yes, so I'm everywhere. Twitter, Chris the Sono One. Yes, Chris the Sono One. I'm there. I'm everywhere on the social media handles. And then today's video, let's continue. Today's episode is importance of ultrasound in pregnancy, reloaded. And then I'm going to talk about the after knowing or realizing that you're pregnant and you have done a pregnancy scan and a test to confirm, yes, indeed you are pregnant. Now, then you also confirm the location of the pregnancy. Last week, I think I explained all this to you, and then also knowing that if the pregnancy is actually going to survive or not. So we have the ectopic pregnancy, you have the failed pregnancy, which is the blighted ovum, and then we also have a mass, a molar mass. We call it molar mass, pregnancy that has formed a mass. Okay, so it couldn't survive. It couldn't, the hormones couldn't, create the sac and all that to continue growing or maybe to another stage. So I educate you on all that, and then today we are talking about, after confirming the pregnancy, you need to confirm that the pregnancy is growing, and that you see a fetal heart or a heartbeat. You realize that your sonographer will show you the image or the video whilst he is doing the scan for you, and indicate that this is the heartbeat. It is beating on the scan like that, and then you are going to enjoy it. It's very interesting. So don't stay at home. Those of you who watching me right now, when you get pregnant, better if you be 6 months crown on your scanda bisa na osi sika ni ho. Like, you are just putting your life in danger whilst you are pregnant. Okay, it's very important. And then you wouldn't even know that the pregnancy is actually growing or it is not growing. I am entreating you to visit a hospital. You can even walk to a scan center yourself, just go and check it. Or you can also come to me, Chris the sonographer. I'll do a scan for you. Nice. And then also those of you who get pregnant and then they are sickle cell negative, without they are sickle cell positive, without them realizing it. Okay, before you take a decision to get pregnant, make sure you check your sickle cell status. If you are a sickle cell carrier or a sickle cell trait, know that this is the situation. It has a lot of consequences during pregnancy. Okay, your likelihood of getting miscarriage is very high, and then a lot of conditions, underlying conditions that can affect you when you are pregnant. Okay, so just know So that one, if you know that the decision will be in between you yourself and your mind, are you still going to give birth or get pregnant or something? Because it has a lot of complications. Complications, yes. So know this before making a decision to get pregnant. So those of you too who are having fibroid, you do a scan and then there's fibroid and you are pregnant. It could also be a trigger to miscarriage. Yes, and then those of you who have had episodes of miscarriage, and you realize that your doctor find out that the cervix of your womb is actually incompetent, or it doesn't have the strength to hold pressure, to withstand pressure. Okay, and so it that causes the miscarriage often. Then you'll be experiencing it. So if you're watching me right now, the moment you have the experience and you get pregnant, the first thing you do is to go and seek for medical attention. Ask for your doctor what you should do, because you are tired of getting miscarriages. Okay, and then they will advise you and maybe take a clinical decision, a decision to protect the pregnancy, to survive, so that you also have your child. Yes, and then during pregnancy, you are not supposed to, at the stage of where it is growing from 8 to, let's say, 12 weeks. Okay, avoid stress. And I know woman be area how baby on so ice kinky, or forgive me for mentioning that. Okay, so please, it is very, very, very important. Stress. This is the time when you are pregnant, you live comfort life. But if don't sit down in your normal time, don't live comfort. Try and get something doing for yourself, so that when you get pregnant, you'll be able to relax and don't stress it up more. Okay, please, it is very, very, very important. So today, if you know that before you get pregnant, know that you are having your sickle cell status, you are okay, you are AA, or do you understand? And then you will not have any complications, even though you can still have complications, because depending on your other clinical manifestations, if you are having other conditions, it can also cause that, but especially with the sickle cell patient. Okay, sickle cell patients, pay attention to yourself, especially when you are a sickle cell patient and then your Rhesus factor is not corresponding to your fetus, the fetus that is in your womb. Okay, when there is always a condition, or when there is always an emergency for transfusion or something, blood transfusion or any medications and all that, it will be very difficult. And if care is not taken, the antibodies cannot be able to fight, if they are not able to fight for protection and all that, and then the other fights against the fetus, it means that it is going to cause damage, and then you have miscarriage, and then it will also cause another issues and all that. Please pay attention to your health, pay attention to your pregnancy. My name is Chris the sonographer. What I'm wearing is from Adepa Creation. Adepa Creation is on Facebook, you can contact them, and then they are also on Amasamai 3 Junction Road, around ICGC. Yes, you can get to them, and then they will also style you. Yes, I'm your Chris the sonographer, the stylist. You can also contact me. I'll just lead you, then see we do business. It's very important. Thank you. Bye. My name is Chris the sonographer. I love you.